Good morning and welcome to the Morning Brew with myself, Madam Foshma, on your airwaves. And today, as we have advised you, we will be having a chat with MIOT Hospital. And they've been in Seychelles for the past year and a half. And this morning, I've got the great pleasure of introducing you to Dr. Prithvi. Good morning, sir. How are you?
Morning. Thank you for having me.
Absolute pleasure. Now, let's talk a little bit about MIOT, especially the branch that's based in Seychelles. A little bit of the history itself, how it's all started. Just give us a little bit of more information on that.
So a lot of Seychelles have been going to MIOT in India for treatment in the last 15 years. But after COVID, we realized that you needed services in-house.
Yes.
One of the main reasons that we were treating patients when we looked at our data was for their eye issues. And therefore, during COVID, we decided this is something that we should focus on and try to provide in Seychelles itself. Therefore, in January 2022, we opened a full-fledged eye hospital in Seychelles.
All right. And how has this been working so far for you, especially with your clients?
It's been working very, very well. The eye hospital performs around 9 procedures a week, sees around 25 patients a day. So in 18 months now, we're very, very happy with the way it's going.
And what are some of the procedures? I heard you talked about certain procedures 9 times per day. What are some of the procedures that the people listening in, potential clients, could actually receive from MIOT?
Well, we do A to Z of eye care. So this could range from simple things like laser procedures, which you don't have to worry about pain or anesthesia, and you are in and out very quickly.
Yes.
Or to slightly more complex procedures or bread and butter procedures like cataract surgery or intraocular implants, etc. We have a full-time ophthalmologist and anesthetist on site, so these can be done at the patient's convenience.
Now, I know you've extended your services over the past year and a half from the eye services, from the eye clinic. What are the services that you have available for patients?
So our focus really is to start from bottom up in Seychelles,
yes,
to provide things that a lot of people need quickly and that can be easily executed at the most affordable rate. So while looking at that, one of the areas that we wanted to focus on was diagnosis. People knowing what is wrong with me.
Yes.
Or people saying, hey, I'm all right, it will get all right on its own, I don't need to worry. So when we looked at this very carefully, we thought the best thing would be imaging services, to take a picture of what is wrong with you. And when you're starting from bottom up, that would mean looking at x-rays. People think that an x-ray is basically something that will just look at bone, but that's not really the case. The x-rays can look at a lot of various scenarios. Yes, the bread and butter may be bone, but it could also be other areas. It could also pick up things like cancers, and in certain cases look at even urological issues, urinary issues.
So it's very how can I say this? Very extensive.
Yes, we have a state-of-the-art X-ray machine, brand new, imported from Germany, made by Siemens. And it is completely digital. You can have an X-ray done. The X-ray is reported immediately by experienced radiologists sitting in India. It turns around immediately and you get your X-ray on a USB stick with the report within 60 minutes, all for the price of 200 Seychelles rupees.
And that is a very affordable price.
That's the point. The motto of MIOT, even back home in India, is to give you the best treatment, technology, service at the accessible price.
And I know you've talked about the quality of the brand that you choose in terms of machineries that you use in your clinic. How important is that for MIOT Hospital?
Well, I think that reliability is important. You want the reliability of the result. You want to make sure that the diagnosis is right, that we're not making mistakes. The images that you're producing are as clear as possible. And I think that this is human being, this is health, this is somebody's life, and it is of utmost importance. I mean, if you look at the product that we have bought for Seychelles, the investment just in this product is $170,000 US.
That's a lot of money.
Yeah, but it's people's lives we are
Quality.
talking about.
Exactly. And let's talk a little bit about where you're based. I know a lot of people perhaps have still yet to hear about MIOT Hospital. Now, where are you guys based? And in general, apart from the X-ray and the eye clinic, are there other services as well that MIOT is providing for the Seychelles people?
Sure. So we are based 45 minutes by air from Colombo. So we are very, very close to Colombo. We're at the tip of southern India. It used to be called Madras, is now called Chennai. And when we talk about the services back in India, of course, in India, the hospital is spread in a 14-acre site. It's got 1,000 beds. It's got 60 specialties. When we look at Seychelles, we are providing services that are essential and possible to provide immediately. That's our focus before we ramp up to finally a purpose-built scenario where we could provide complex services. So our next foray from this would probably be ear, nose and throat disease, because this covers children, young adults and the elderly, and there is a big need here in Seychelles.
Perhaps when you, I know you've talked about a survey or market research where you've sat, of course, all your professionals have sat together and, of course, checked that at the local market. What are some of the major problems that we are seeing in Seychelles in terms of medical?
So you may be aware that for the last several years, every month, MIOT does 2 free medical camps in Seychelles. And our specialists come over and they don't charge a fee and they see patients. So based on that, we are seeing a lot of NCDs in Seychelles. So when you talk about what is the biggest problem, I think it's a worldwide problem. It's to do with how we look after ourselves. And that is the reason why we are getting a lot of disease. So back home in India and similarly in Seychelles, there's a big problem with obesity. And similarly back home in India, but to a certain extent in Seychelles, there's a big problem with uncontrolled diabetes.
And that is one of the...
Yeah, I think that this is responsible for a lot of the morbidity or the bad quality of life that a lot of people are ending up having to deal with.
And of course, I know there are a lot of patients that are obviously getting treatments from the local hospital in Seychelles.
Yes.
Are they able to bring in their information and, of course, you use that to investigate further into what is really wrong? Can they be accessible to your services as well?
No, absolutely. The Ministry of Health in Seychelles has done a remarkable job of going paperless and digital, and this has enabled easy and quick access to information. The Ministry of Health Seychelles has a very good relationship with MIOT in Chennai, and a lot of their patients are treated there. A lot of the specialists who work at the ministry are extremely collaborative with the staff at Chennai, and therefore there is seamless transfer of information between both sides, and we look at a great relationship, a synergistic relationship between the private and the public sector.
Yeah, and I know you've mentioned the Ministry of Health in Seychelles.
Yeah.
What are some of the other partners that you're working with currently in Seychelles?
Well, basically, Seychelles' scenario is unique compared to several countries in the world.
Yeah.
You've got a population of 90,000 and healthcare is virtually free. The bulk of the population is treated by the Ministry of Health. So the data, the accessibility, and the sheer healthcare fraternity is really powerfully based and centered around the Ministry of Health Seychelles, and they are really our principal partner. But of course, we collaborate with a wide range of GPs in Seychelles, and we have a very good working relationship with many of the entities that exist here. But when you say who is the person that you're talking to the most, that would just be the Ministry of Health.
The Ministry of Health. Now, I know you've spoken about being based on Mahe, which is the main island.
Yeah.
Do you provide perhaps services traveling to Praia or Ladigue to perhaps check up on patients that not necessarily can't fly in to the main island or necessarily travel to the main island?
So this is something that's been happening ever since COVID started.
Yes.
And it's been rolled out to the entire population of Seychelles, not just the main island. Every single patient that we see gets a free telemedicine consult 6 weeks after they see us. And this is also for patients who come to India for treatment. So we connect with them 42 days after they've seen us to follow up what they're doing, how they're managing, what medicine they're on, and try to fine-tune their treatments. So this is something that's been ongoing for the last 2 years.
Now, we apart from the X-ray, we see that you've mentioned there are several other issues you can pick up from the X-rays, and I see a list of other things: barium swallow, gastro, barium meal, intestinal, barium minima, tumor. How easy or difficult is it to spot these issues via X-ray?
So one of the things that people should look at, especially in healthcare, is horses for courses.
Okay.
So our focus, of course, is on diagnosis and making sure that we utilize modern technology, but also our aim should be utilizing available technology to the maximum in this scenario as required. And when you look at Seychelles, one of the big issues is accessibility. That means getting there.
Yeah.
And the second thing is, of course, affordability. So, of course, the Ministry of Health is doing a great job, but there's only that many machines available, but the number of patients is increasing. And so we thought if this particular amazing product that we have can be used if you've got digestive problems or cancer or even urine issues, breathing issues, ear, nose, throat issues, that would be great. There are also other areas that we've not mentioned, like neurology, where you might have problems in your spine, you might have problems in your nerves, you might have problems with stability in your back. A lot of these things can also be diagnosed by the same machine. So yes, when you look at X-ray, you sort of seem to have, as a medical professional, a very coned, focused view, but when you actually go and examine the technology, it's much wider than that.
So you can pick up a lot of other things.
Absolutely.
Now, I know we spoke about the building, we've spoken about the venue, we've spoken about the machines, the people of MIOT.
Yes, I think we have a great mix here in Seychelles. We've got around 16 Seychelles locals working for us, and they provide a lot of the service. In certain specific areas where currently the talent is not available, we've obviously had to bring people over, have them accredited by the Ministry of Health, and then work for us here in the Espace building.
Okay, and let's talk a little bit about the services. I know you've said there are quite a bit of services that you're providing in Seychelles. What happens if a patient needs follow-up or even further medical services? Are they referred to MIOT in
So the patient
Chennai?
has a choice. The patient could seek treatment here in Seychelles. There are obviously opportunities with the Ministry of Health. There are some private providers that may take up certain disease treatment scenarios, but a bulk of the tough diseases to tackle, which need complex multidisciplinary approaches, they would need to go overseas, especially if the patient has got 3 or 4 diseases complicating the ongoing issue. And in those cases, yes, we work with the Ministry of Health a lot of the time to try and support these patients so that they get continuity of care even if they go overseas.
Now, let's talk about, I know you've perhaps yet to consider bed for patients, in-house patients. Is that something in the pipeline? Where is MIOT on that?
So currently, all these scenarios in Espace building are called day procedures.
Yes.
That means you can't have a patient there for more than 23 hours. That's the definition internationally.
Okay.
Let's see where it goes. I think this is a process of building trust and something that will happen in time once our partners in the government are able to appreciate that we are a genuine organization, that we are an organization that can be trusted, and that we are not here for a quick buck, but we're here for the long term. I think that is something that is inevitable, quite inevitable, and it will happen.
And the partnership between the government of Seychelles and MIOT right now?
So right now, the Ministry of Health sends patients to MIOT that they cannot offer service to. So if the Ministry of Health is able to offer the service, the patient, of course, stays under their direct care. If by chance there's a particular service, for whatever reason, that they cannot provide, that and that alone is treated by MIOT.
And if a patient, perhaps under the care of the Ministry of Health, would rather be sent to MIOT for services, is that a personal choice of the patient?
Yes, I think that those are issues that are governed by your framework, and they have protocols where if the patient, as you said,
No hard feelings.
wants to make a choice, patient wants to make a choice,
Yes.
then yes, of course, as a free country, you permit your patients to make a choice, and that pathway does exist.
In an area where perhaps there's no specialist, precise specialist for that particular issue, is MIOT considering perhaps on intervals of, certain picks that they send in specialists to perhaps cater for other issues that patients have in Seychelles?
This is something that's ongoing, and that's
Yes.
been happening. A year and a half ago, we sent specialists from MIOT to train the Ministry of Health doctors on how to do a procedure called AV fistula, which is essential for dialysis. And he spent almost a month here training people, and now that can be done in Seychelles.
Is that the joining of the arteries?
Yes, so you join an artery in a vein so that you can do dialysis.
Okay.
And also recently we've had requests that we did support for the Ministry of Health to send a cardiologist and to send a radiologist for a certain period to do some of the work because there was a work lag. All these services are provided by MIOT Chennai free of cost, so we don't charge for those specialists.
And for patients in Seychelles, perhaps, Dr. Prithvi, who may start with MIOT Seychelles, but then they find the necessity, or they've been referred to travel overseas for further medical care. Is there a package on offer for Seychelles patients whereby, because we've treated with MIOT in Seychelles and we're moving to MIOT in Chennai, is there a special package available for these patients?
All Seychelles patients are treated specially. So I live...
We should feel lucky.
Yeah, I live in the 9th floor of MIOT, and I see every single Seychelles who's there every day. Also, they are treated especially in terms of giving them affordable pricing. Every single week there's a program for Seychelles so that all Seychelles can meet and have a meal together. This is provided free of cost. It's called Happy Bites. So there's a whole lot of program for Seychelles, irrespective of whether you're from the Ministry of Health or you've seen in MIOT Seychelles or you're just a Seychelles who belongs to neither. Everybody's treated the same. You're all special.
And what is the future of MIOT in Seychelles?
Well, I think the future looks very, very rosy. This is a beautiful country. It really is like paradise. It's safe, and the people are amazingly friendly. So I think the board at MIOT is convinced that Seychelles is an area that we should be investing in, and definitely there is no doubt that there will be a purpose-built project for slightly more complex care in the years to come.
Complex care in terms of?
Well, it could be anything. I mean, right now, it looks like the way to go would be cancer care, but let's see, you never know.
In terms of fertility, I know a lot of women out there, in Seychelles, of course, are seeking these special services. What are MIOT perspective of that?
Well, as you know, India is a country of 1.5 billion people. So maybe one way to deal with fertility, if women are seeking fertility, is just import a few Indians. But apart from that, obviously, seriously speaking, fertility program under the gynecology obstetrics wing is not very difficult at all. The technology is around for a long time. A lot of the work has to be done in a laboratory. So this is an investment which is minimal. It's around
in terms of IVF, in terms of
so the investment will only be 250,000 US, which is tiny compared to the 2 million we've already poured into Seychelles. We're not looking at it because right now, we don't have our own facility. We're in rented premises. But I think we will roll it out in time to come.
In terms of lab services, what are on offer in Seychelles right now?
So Seychelles as a country has virtually everything that labs can offer. The problem is pricing. So the issue that you have is that everything has to be bought. Nothing can be rented. And therefore, when you look at the pricing that's rolled out in Seychelles, so whether it is microbiology or histopathology, because these are the higher end areas, or immunology, the pricing is prohibitive. So we are looking at strategies to put in place so that it becomes more accessible and affordable. Until then, we're not rolling out laboratory services, but we will soon.
In terms of pharmaceutical, patients are coming in. Of course, they will need the specific medications referred to, prescribed by the doctors. How is MIOT coping with that?
Well, I think that the Ministry of Health Seychelles has got some very, very robust and necessary regulations in place to make sure that you don't have poor quality of medications brought in, and also to make sure that there is no antibiotic resistance. So we are actually looking into the regulations and working with the Ministry of Health so that when we do get into the pharmacy sphere, as you said correctly, not only will we meet the quality controls, but also we will try our best to look at the affordability and accessibility.
And how important is quality control for MIOT?
I mean, quality control is something that is part of our DNA from the time we started 24 years ago. We've always invested not only in terms of technology, but also in terms of staff, huge investments to make sure that anybody who comes to MIOT not only gets the best in terms of medical treatment, but really the best possible experience in terms of compassion and the way they get treated. This is of huge importance in healthcare because I think medical treatment is only 50% of the battle.
Yeah. Doctor, I know this is perhaps not really directly related to medical services, but however, we've heard the government talking about diversification of businesses and of course the industry. We rely on tourism. How important is medical tourism to MIOT, and is that perhaps something that you guys will be exploring into the future?
No, I think medical tourism is a very, very interesting space. India is a funny country because the people who come to India really come for medical care. There's not too much tourism involved. Your country truly is a remarkably beautiful country, probably the most beautiful country that I've visited in my entire life.
Careful there, you might want to stay.
And I think that could definitely be used to your advantage once the medical services here, as you said correctly, have a wide range of choice. They're accessible, and there's very, very groundbreaking technology available. There's no doubt that this will become a hub for this entire region.
I think fundamentally people listening in today would want to know, what is the mission statement for MIOT Hospital?
Well, I think for an outside player to come into Seychelles and say that I'm looking at medical tourism would be a very grandiose statement. Definitely our immediate goal is to try to provide everything for the Seychellois so that it's available on your doorstep without leaving your country.
Yes.
And then hope from that strong foundation build up to providing services for your tourists who are pouring in.
But just that in itself is cutting the cost. Just
True,
having these
true.
services available on land here
True.
is cutting the cost. Now, I know obviously you've had the time perhaps to meet up with some of the patients that are under your hospital, getting the service. How are the feedbacks from your patients so far?
Well, I think, Seychelles is such a great country to come to because the people are so amazing. I mean, their outlook is so positive, their energy, they're vibrant. So, yes, we're very, very surprised, pleasantly surprised that virtually all the feedback has been very positive. And as a result of that, that gives us the inspiration and that really gives us a big boost to do more and more for Seychelles.
And Dr. Prithvi, on a personal note, your first time in Seychelles, you came to the Seychelles. What was your first perspective of Seychelles?
Oh, wow. Yeah, it was a long time ago now. I've been coming here since I was in my late 30s. Yeah, but the first time I came here, really, it was a utopian experience. It's so... I've visited so many countries, so many island countries, from Fiji to Maldives and everything in between, and Seychelles is truly, truly unimaginably beautiful. I mean, you've got definitely the best beaches, a real contrast in the sort of vegetation that exists, the scenario that exists, and the most important thing and the big selling factor is the good-hearted, welcoming nature of your people. Really blows you away.
And Doctor, what are the final few words you would like to extend to listeners today in terms of medical practices?
Well, I think you're going to see a huge change in the face of available and accessible treatment in Seychelles. It's a great time to be patient in Seychelles in the best possible way, and I hope and pray that there will be more opportunities and more choices for the people of Seychelles for their healthcare.
Which reminds me for a question which I forgot to ask. How important is a medical checkup for an individual? I know a lot of people, especially men and women alike, we tend to wait until the final minute when we're feeling, I'm a bit sick.
Yeah.
That's when we go to the hospital. But for just as a routine checkup, how important are routine checkups for both men and women?
So I think the 2 C's are big talking points in Seychelles, cancer and cardiac.
Yeah.
So I think, having an annual checkup to screen for the common cancers and obviously for the condition and health of your heart every year are essential for both men and women in Seychelles.
And Doctor, on a final note, any last words we have to say before we wrap things up for this morning?
Any last words you want me to say?
Yes.
All right. Well, I just want to say, I'm so glad I discovered this beautiful country, and I'm sure that MIOT will be here to stay, and, I will just keep coming back here for more.
And I suppose this is a vacation, a sort of work/vacation for you whenever you come to Seychelles.
Yeah, I mean, whenever I come to Seychelles, although it's only work, for me it feels like a vacation.
Dr. Prithvi, it was an absolute pleasure meeting you this morning. All the best to you and your team. And of course, for those of you listening in, you can find MIOT Hospital at Espas Building. You can give them a call and of course set up your routine checkup, not just because you're sick, but in general, it is important for you to have your checkup. Give them a call on 4303-525, 4303-525, sorry about that. Or you can call them on 2638-633. And also you can email them on inquiry at miot-totalicare.sc. These are, of course, the different services for the total eye care. But if you want for your medical checkup, as I said, 432-6693 is the number for you to give them a call and have yourself a good checkup. For those of you celebrating your birthdays, hey, why about that? A good gift for yourself is to make sure that you are feeling fit as a fiddle. On this note, we're going to take a little break. We'll be right back. Thank you for that, Doctor. It was an absolute pleasure meeting you this morning.
Thank you.